Hi everyone, welcome to today's video. Welcome to Vlogmas, episode number 2. It is the week of December 13th, so Friday the 13th. It is 4:59, so I will be picking a winner from last week's Vlogmas episode for the Avita Ven cat bed, and so I'll flash it up here. And then I will also notify the winner. So congratulations. If you are the winner, just go ahead and email me. My email is in the description box, your shipping information, and we will get that out to you. We'll be having a winner in today's video as well, so hang out with me, and we'll be picking that in a few minutes. So this week I had a very eventful week. Monday started off very busy, and so we had some cool cases I'm going to share with you today. This week, the week of December 13th, I saw a total of 40 cases. 34 of those were cats, or excuse me, 34 of those were dogs and 5 were cats. So we talked about how on last week's Vlogmas, there's always a dichotomy there, and it was about 50-50 last week, which was abnormal. This week, 34 to 5, and so that's kind of more normal. So more dogs than cats. Of my 40 exams, only 15 of them were wellness, so the remainder of them were sick visits that we had to tend to medically, not just, your average, puppy kitten shots and things like that. We did 6 surgeries this week. 1 spay, 2 dog neuters, 1 dental prophylactic cleaning. I placed 1 drain for a hospice case. So it was a case of a pet with a very large cystic tumor. They weren't ready to say goodbye. So I did place an indwelling drain in that to give them a little bit more time. And then I placed 1 esophageal feeding tube in a cat. And that's going to be one of the cases of the week we're going to talk about today. I forgot last week to mention, but I'll add it on to this week. I did do 1 end-of-life service this week, so 1 euthanasia practice this week. Last week I did 4, and so don't want to be sad in these episodes, but that is actually, I'm doing this to give you guys an insight into, potentially your veterinarian's daily life, and that is a part of our daily life. Last week, it was a part of my daily life. Literally almost every single day I was in the clinic. So I worked 5 days this week, worked 5 days last week. I only did 1 euthanasia this week, but just keep that in mind. If your veterinarian seems maybe a little bit down or a little bit reserved, it could be that, they've had to live through that burden. Certainly it is difficult on you guys when that occurs, but it's difficult on your veterinary staff as well. So, 1 end of life visit this week, but for last week. But let's move on to the good news, the cases of the week. So there were 3 cases of the week. One of the cases of the week I just saw right before coming up here. First case of the week was a dog that came in diagnosed with some renal disease last year. That has progressed. They came in with acute on chronic renal disease plus pancreatitis, and that landed this girl in the hospital. We were able to manage that with some IV fluids and correcting electrolytes, and typical to very good beagle behavior before the end of the day with the fluid resuscitation and anti-nausea medication. She was eating a renal appropriate diet and was able to go home the next day after her fluid resuscitation. So that was case number 1. Case number 2 is still a mystery. We do not know what this cat particularly has. Does have some liver issues, but we do not know the cause. We have run some repeated tests and have not come to a specific inciting cause. But the long and the short of it is, second case of the week is a kitty, and we call them yellow cats. So he is an orange kitty, an orange tabby, but he's suffering from severe jaundice and liver damage. We don't know why. This case was sent to me from a colleague, so I practice in a practice, and there's multiple of us, right? So there's 3 doctors that work here, and we all do different things. So we've got an exotic vet, then we have a vet that does a lot of our elective surgeries, spays and neuter. She sees cases too. I see cases, I don't see exotics, so I refer those to my exotic robotic person, or refer the electives to my elective surgery person, and then I a lot of times will field a lot of the more complex internal medicine cases and the kind of the weird surgeries and things like that. And so we collaborate. And so this particular case, this yellow cat was sent to me for the placement of esophageal feeding tube. And so that is a procedure that I don't honestly think gets utilized enough. And what happens is when these cats turn yellow, they can turn yellow for a lot of reasons. But the big resounding thing is that they stop eating. And we can get them back to eating, and we can give the body time to heal. But in cats, if they go more than 5 days without eating, the body literally starts to shut down and the liver starts to essentially eat itself. And so we've got to get this cat eating. And it's very traumatic to try to force feed these guys. If you watched my video on first aid, it's not really an ideal thing to force feed a sick animal because there's a choking hazard there. You really can't get enough nutrition into them that way. And so in cats, this is most utilized in cats, but it can be done, in other species as well. Actually, Dr. Hughes did it on a turtle this week, in the same day that I did this on a cat. But we place an esophageal feeding tube. So here's a picture of that. It's done under general anesthesia. We put this little feeding tube in, and it basically goes in the side of the neck, goes into the esophagus, not the stomach, the esophagus, and it just pokes out. And the owner can put food in there. The owner can put medications in there, so they don't, the pet doesn't have to be hospitalized anymore. All the nutrition and the water it needs and the medications can go in that feeding tube. And while the feeding tube is in, the pet can still eat normally. So, we always have food down, and when the body is healing, and this could take time. This could take months. These feeding tubes can be in. The cat is eating a little bit more, and then eventually it's eating where we need it to be, and we just pull that feeding tube out. So it's a very quick procedure. I don't remember how long it took me, maybe 5 minutes. And so very quick procedure under very short acting general anesthesia. And it's a great tool that we utilize in my practice. And so I actually got an email today from the owner saying the cat was doing really well. She felt really comfortable with the feeding tube. He was actually starting to eat some of his treats now. Again, with that feeding tube in place, he can still do that. And we're going to build upon that and build upon that and build upon that. So unfortunately, we don't have a diagnosis. I'm sure there is a reason out there, but we've kind of decided, this is where we're stopping with our diagnostic process. We're going to just focus on treating and getting him through this without specifically knowing. And I think we're headed in the right direction. So that was yellow cat. Third case is a little dachshund I've been seeing for many, many, many years. Came in today, lethargic, lost 6 pounds. He was already overweight, but had lost 6 pounds in the last couple months. She felt he's been off for a couple months. It's kind of accelerated. She brought him in, did blood work, and boom, diabetes, cha-cha-cha. I don't know why I always do that. It's something I learned in school. I don't know, when we were memorizing things, and I always say it that way. But anyway, he had diabetes, and so, again, something totally manageable, and I do hope to do a more in-depth seminar on diabetes because there's a lot that's evolving in diabetes in pets. It's not the same as diabetes in people. A lot of people, again, like to assume that it is or take that jump that it is. A lot of pet food companies falsely lead you to believe that when it's really not. And so conversations with the owner, and we did get him started on a regimen today for insulin supplementation. We're going to do a pen because she felt uncomfortable with needles and injections, and we got him started on that. And we're going to be doing some dietary modification in a month's time once we feel like we're in the swing of things. And so those last 3 cases, the reasons why I chose those specifically is in every single one of those cases, diet is playing a major role. And so the renal case had not only kidney disease, but concurrent pancreatitis. The cat has a feeding tube. That's a no-brainer. We have to calculate and figure out, the nutrition because that's all he's really getting. We've got to make sure we can sustain life through this feeding tube. And then the third one, diabetes, obviously has to do with blood sugar, and eating is very important. Not only do they need to eat to get their insulin, but we need to be eating, and we can use diet to help control the diabetes once it has been diagnosed. And so I wanted to kind of discuss, because I've been asked to discuss this before, and it mostly pertains to me, but I think it most likely pertains to a lot of veterinarians, what type of nutrition education do veterinarians get? And I think there is a lot of misinformation out there. I think that misinformation is coming from third parties who didn't obviously go into veterinary school. And I never like it when you lump a group of people together and say all veterinarians don't know about nutrition because of X, Y, Z. And so rather than do the same thing and reciprocate and say, no, that's not true, all veterinarians do get X, Y, Z, I'm going to focus on my experience, my personal experience, my firsthand experience. And I think it's most likely very similar to other veterinarians' experiences, and I think it's probably more accurate than a random, third party that came up with this. And you can probably guess why the third party and who the third party is that came up with this, and what motives they may have had to try to strike a stake between trust between you and your veterinarian. So really think about that, because that's a pretty nefarious endeavor, I feel. But nonetheless, I do want to share with you nutrition education and answer that question as it at least pertains to me. In the year that I graduated, certainly it could have changed, in the time that has transpired. So when you go into veterinary school, there is prerequisites that you have to have, right? You can get into veterinary school pretty much with any degree you want, as long as you have the prerequisites. So many of us are, from the sciences, biology, zoology, things like that. But you can go to veterinary school, and there were people in my class that had like literature degrees. But regardless of that, you do have to take some prerequisites. And one of those prerequisites is animal nutrition. This is animal nutrition that is not taken through the veterinary school, okay? So I know one of the big conspiracy theories is the big three pay veterinary schools, and so they teach them whatever the curriculum that they want. Well, we're talking about animal nutrition taught at an undergraduate level, as an undergraduate degree through every university across the nation, and that's just insane to think that the big kibble is paying off every single educational institution, across the nation, okay, across the world. And so you have to take an animal nutrition class. That animal nutrition class is not 20 hours. I don't know. I've heard that number thrown around. I don't know where it came from, honestly. That's why it's important to check your sources. I don't know where that number came from. 20 hours. It's a course, and I think it's listed in my description box. But it's like booty in the chair. When I was there was no online. It was booty in the chair. Booty in the chair for an entire semester, 5 days a week. Booty in the chair. And that's way more than 20 hours, I can tell you that. And the tests are not online tests. They are booty in the chair, writing down, answering questions, paper test, okay? And so office hours, you can ask questions. There's a teacher's assistant, you can ask questions. I mean, it's a legit educational course. That's just undergrad. Everybody has to take that. It's a requirement. Then you get into veterinary school. And the first year of veterinary school, at least at my university, is broad topics, right? It's broad topics. It's anatomy of the large animal, anatomy of the small animal. I think they call them body systems. So big groups of body systems. So large topics. And, that's just kind of getting your feet wet. The second, third, and fourth year is where you get into the nitty gritty. And that's when you start doing individual organ systems, individual disciplines. So that's all your ologies, okay? It's also where you start getting into the clinic and you start clinically practicing some of the things, forming differentials, forming diagnosis, seeing cases. That happens in your part of your second year, and then again in your fourth year. And so what are the ologies? The ologies are like every single system, guys. I mean, we're talking about every single system for every single species, okay? So we're talking cardiology, dermatology, neurology, orthopedic surgery, soft tissue surgery, urology, endocrinology, toxicology, pharmacology. I mean, I have, if I can find the picture anywhere, I have a picture when I graduated vet school, my very last day of clinics, standing against the wall, and my stack of books of all the ologies was taller than me, okay? Every single one. Actually, let me see. Yeah, I can't even grab them. I still have them. They're in a closet here. Not all of them, as I've moved like 6 or 7 times, so I've lost. I was looking for my nutrition one to see if I still had it. I can't find it anywhere, so it's got misplaced somewhere. But nutrition is one of those. It's one of those classes that you've taken throughout, you know, one of those specific courses. And again, it's a semester. We're not booty in the chair. This is not online. This is a semester class. You're sitting there for, I think it was it might have been 2 or 3 hour block a day that we sat there and did it for an entire semester. And if you want to know what you learned in that class, look at that small animal clinical nutrition book. That's not the textbook we had. Again, I told you I've lost my textbook, but that's the kind of stuff that we learn. The science behind nutrition, the literal science behind it. And that's what you learn in that nutrition class, however many hours it is. I don't know how many it was. And there's a difference between a credit hour and a contact hour. So that's another thing. I think maybe that's where this 20-hour thing, you know, maybe came about, was credit hour. I don't know. But anyway, nutrition was a class just like neurology was, endocrinology was. So the same amount of time that I learned about diabetes is the same amount of time that I learned about nutrition. The same amount of time that I learned about kidneys, same thing. Orthopedic surgery, same thing. The only ones that were longer were internal medicine, and some of the soft tissue surgery classes were really, 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 really long, because, you know, that's a lot. That's a big block there. The internal medicine is just a lot of stuff. It's not just oncology. So, you know, that's how the individual classes work. But it doesn't stop there, right? Okay. So why did I bring up these cases as an example? Because in every single one of those other ologies, nutrition is broached upon as well. And so even if I were to acquiesce and say, okay, yeah, it was 20 hours in my clinical nutrition class, it doesn't account for all the nutrition you learn in every single other class. So when I had my endocrinology class and I learned about diabetes, I learned about the diets to treat and prevent diabetes. When I had my renal class, we learned about what the disease pathology is and how diet can be used to treat and prevent that pathology. Not a specific diet, the science behind the diet. When I learned about putting this E-tube in, I had to learn about how to formulate and calculate and ensure that everything I put in that E-tube is proper daily nutrition for that pet that's not eating anything else. When I was in school, I had a case that was severely diabetic and had to be on TPN, which is a total parenteral nutrition. Learned that outside of my nutrition course. So every single class, dermatology, zinc responsive dermatosis, vitamin A responsive dermatosis, all these things are touched upon. Nutrition is touched upon in every single one of those classes. And so it's not just as simple as saying, well, how many hours of a nutrition class did you take? I probably could figure that out, but I can't figure out all this ancillary stuff, all this additional stuff you learn every single class. When you're in surgery, okay, what do pets need to be eating after surgery? If they have cancer, what do they need to be eating after their chemo? You know, how can we, you know, what foods are acceptable, what foods aren't acceptable, which foods are contraindicated? Integrative medicine, I took a class in integrative medicine. That's a whole nother ballpark, and how Western versus Eastern medicine, okay? So I just wanted to throw that out there for food for thought, and please always think about when people are trying to promote their cause by putting another cause down and talking negatively about them, because that should be your first warning sign to think, you know, maybe I should ask the source. And that's what I ask you guys, and I'm thankful for the one subscriber that said, look, I've been hearing all this, and I want to ask you personally, what training did you get? And so I do appreciate that, because I don't like to be not falsely accused, but you know what I mean. I just want, if you have a question about your veterinarian and you question whether, you know, what they have, or if they feel comfortable with something, just ask them, hey, do you feel comfortable with this? Do you feel comfortable with, you know, managing this case with nutrition, or should I see a boarded, you know, nutritionist? That's fine. They're available, and that's what they're available for if your personal veterinarian doesn't feel comfortable with it. So that's kind of my take on that, and I wanted to express to you that, yeah, we do nutrition every single day I do in my practice. Right here, 3 cases imperative, but that doesn't even count, you know, the number of other cases that we talked about, especially the wellness exams and things like that. And so that's how nutrition is taught in veterinary school. At least that's how I was taught nutrition in veterinary school. So I wanted to highlight that today and answer some of those questions, because they seem to be circulating a lot. And with that, so that brings us to this week's giveaway, right? There's going to be a couple giveaways today, actually. There's gonna be one grand prize winner that's gonna win this entire Pretty Litter grand prize, minus the pips, because I gave the pips to Tony. He really loved them, so I gave the pips to Tony. So you don't get the pips, but you get the mat, the Pretty Litter, and the toy. And so leave me a comment in the description box today about whatever. And I will pick a winner 1 week's time from today. So the winner will be picked at 5 p.m. on the 20th, December 20th. That'll be the grand prize winner. And then I'll pick, I got a bunch of more, look, I've got a bunch more Pretty Litters there. So I'll pick a couple other winners as well. I have to see how many bags I have, but I'll pick a bunch of other winners as well. So leave a comment and there'll be a couple winners on this video to win some Pretty Litter. So I hope you guys enjoyed. Thanks for hanging out with me. Vlogmas episode number 2, and I will catch you guys for another Vlogmas next week on the 20th.